So chemotherapy-induced nausea and vomiting are truly very distressing symptoms, and truly for radiotherapy also these are very distressing symptoms. For chemotherapy it's very clear what to do because it has been very well investigated, and we know that adding an NK1 receptor antagonist to a serotonin receptor antagonist and dexamethasone improves the antiemetic efficacy. For radiotherapy and concurrent chemotherapy, we haven't got any data on this. So the current standard of care for radiotherapy and combined chemotherapy-induced nausea and vomiting are that used for chemotherapy. So we did a phase 2 study in patients with gynecological cancer scheduled to receive fractionated radiotherapy and concomitant weekly cisplatin. And in these patients we found that the sustained no emesis, meaning the probability of completing 5 weeks of treatment without emesis, was only about 57%, meaning that there's a big proportion of patients actually vomiting during the treatment. So that's the rationale for conducting the emesis study, which is a multinational study conducted in 4 countries, and it's a randomized study, placebo-controlled and double-blind, and patients are randomized to receive either a 3-drug antiemetic regimen or a 2-drug antiemetic regimen. So the 3-drug regimens consisting of fosaprepitant, palonosetron and dexamethasone, and the other regimen patients receive placebo. So patients were completing daily patient diaries, and from these we obtained the data consisting of emesis, nausea and use of rescue antiemetics. The primary endpoint in this study was a sustained no emesis, meaning the probability of completing the 5 weeks without emesis. And the secondary endpoints were no nausea, complete response defined as no use of antiemetics and no emesis. And of course safety was an issue to address. So the results, what we found and was both clinically and statistically significant, was a difference in the sustained no emesis, meaning that patients with only receiving the standard antiemetic regimen had a probability of completing the 5 weeks of treatment at a rate of 49%, and we found in the previous study, and this number in the previous study, this number was 57%. It was a non-comparable phase 2 study, so we can't really compare these two numbers, but it seems fairly similar. And if we add the 3rd drug, then we can improve the sustained no emesis rate by 17%, and we find this both clinically and statistically significant. So for the other results, we found the complete response rates during 5 weeks of treatment in favor of the fosaprepitant regimen, and this was true for nausea also. Safety, both the regimens were well tolerated, and we only had few infusion site reactions. This has been an issue for fosaprepitant previously, but only 5 patients had a reaction, and it was only mild. So we think that it is well tolerated and have no problems for safety.